Hey, welcome to our office. I'm really excited to meet you, and I know we're going to be talking about your surgery today and what your goals are, specifically the SoMe breast augmentation. First off, what does SoMe mean? We came up with the term or the name SoMe, which in some ways stands for social media, but also stands for SoMe. Like, this is SoMe. This is customized to me or to you. So SoMe augmentation has a few components to it. We named it this because it was easier than saying, this is a composite breast augmentation, which includes internal bra, a highly cohesive implant, fat grafting, and a lift. That is a mouthful. So we say SoMe breast augmentation in our practice here because that helps us understand the components of what we're putting together to give you the look and the feel that you're going for. So one of the main components of the SoMe breast augmentation is a breast implant. That breast implant can be silicone or saline, but they're typically silicone and they're typically a more gummy or a more cohesive implant. When I stand this implant upright, you can see here it likes to keep its shape, and it will do that over time. So these are what we call gummy or cohesive implants. But to keep that support over time and to prevent an implant from slowly dropping on your chest, because many people want to maintain that fullness over time, I add what's called an internal bra, which is Galaflex or P4HB. It's poly-4-hydroxybutyrate, that's a mouthful, but it's a bioabsorbing material, meaning it is not permanent. So this material here, it is a scaffolding. This is a soft tissue scaffolding that has a defined shape to it. It is not a mesh per se, but it is an absorbing material that will rest under the implant within your body and help support it. And it'll keep it suspended. Don't tell anybody, I'm gonna show you right here. But this will keep the implant up over time. And what happens is the body recognizes this material and it slowly will break it down over about 18 to 24 months, period. What it does is creates type 3 and type 1 collagen to replace this material in your body, and it will turn this into carbon dioxide and water. So in 2 years, this material is actually gone. So that's why it's non-permanent. However, your body builds up about 4 to even 5 millimeters thick of your own collagen to support that implant over time. So the effects of this can be permanent, but the material itself is not. As we know, implants are also not permanent, and these typically are switched at about 15 years time. But when we combine the internal bra and this gummy implant, you can really maintain a lot of fullness even without wearing a bra. This material is FDA approved for soft tissue support, but in the United States, it is not FDA approved for the term internal bra. So it is an off-label use, and I let all my patients know that. But like many other things that we use, quote unquote, off-label, this is a material that has been found to be very safe, and we use it in the body and a lot of other places as well. Besides the internal bra and the implant, the other components to a SoMe breast augmentation include fat grafting. So many times people might have a widened cleavage, and because we put the implants underneath the muscle, we can't really change that cleavage with the implant. So we use fat grafting. We will take fat from other parts of your body, whether it's your tummy or your inner thighs or an area that you're desiring, and we can put that carefully and safely into your cleavage lines to create a more close cleavage, even without wearing a bra. And then the last component of a SoMe breast augmentation may be a lift. Some women need a full lift, which looks like an anchor pattern, and some women just need a small crescent lift. So that's something that we will discuss in your consultation and figure out exactly how to create a SoMe look for you.